coming back, I think all of you have joined and all of you have to leave also. We have already dealt with the examination of mouth, collection of rumen fluid we have seen and you have done also. Then we are in examination of rumen fluid, and in continuation of this, I will discuss certain tests today, and then followed by in the next class, I will discuss some of the radiological examination, the finding what we have in our clinical complex. I will take all the picture and test here and discuss the different types of diagnostic technique with the help of radiological examination, that is X-ray, and then ultrasonography of the GI tract, although this is the most difficult part of ultrasonography. First, we have to understand the different layer, how the different layers appears, and how you declare that this part is swell and this part is bigger than this. So comparison will be made on the basis of normal sonography, and then some of the abnormal sonography I have, for example, intussusception and certain foreign bodies in the GI tract, how it looks in the radiological examination, that is in X-ray, and how it looks in the ultrasonography, and that I will show. And then endoscopy, the last part of a special examination of digestive system. I will hand over to Dr. Ramesh Tiwari sir for a special diagnostic technique as the last part, because he is really doing the endoscopy. I can also teach the theory portion, but really he is passing the probe. So machinery operations and all this will be dealt by sir. So we have already seen the different method of rumen fluid extractions. If more fluid is required, then we have to use some machine. Otherwise, for a smaller collection of the fluid, it can be done with the help of a syringe and needle, and then we can check the pH, we can check the rumen flora activity, just like a wet film examinations. And then other techniques like if we want certain spatial diagnostic, we can go for protozoa activity test. Then a staining technique will be dealt, and today I will deal with the staining process also. In this context, our first practical, today I will deal only the 3 practical because it's a long list of practical in the rumen fluid examination. And the very simple, as the name indicate, is the first test, that is the sedimentation activity test, as the name indicate, or stratification of rumen fluid. It means if you collect the rumen fluid, as we have seen in the previous class, the method of rumen fluid, and also we have seen this, the slide, the color, the consistency, the order of the fluid, and the pH, all you will measure as a physical type of examination. And after doing that, if you want, and then the 2 very, very important tests, as we have discussed in the previous class, that is sedimentation of the rumen fluids, and that is called SAT test or sedimentation activity test. And then the second one is the cellulose digestion test, although even we are not doing as a routine practice because it takes some time, but as a large animal practitioner, and if you see the cases that is referred in our colleges, and they are, and the owner complained that my cattle is not eating from last 15 days, 20 days, and they are only on the fluid, then it's our role to go for such type of test. And I think when you will come and then we'll cover this practical, certainly we will put a stress when you will come here for this type of special test, not in all cattle, because only few cattle are admitted here, but we must check. First, we will check in our in farm some of the animals that are sick for a long time. We will collect the fluid from them, and then we will go for the practical demonstration. So sedimentation activities test or stratification of rumen fluid, we will go first, we will see the procedure. The normal fluid has a tendency to form different layers. When you will collect the fluid as as you collect any type of fluid, and when you kept it undisturbed, you will find a different strata will be there. On the top, something will be there. On the bottom, something will be there. And in between, there will be some clear fluid, like something clear fluid will be there. Finer particles settle in the bottom. More fibrous parts settle on the top. So they will form a stratification. For that, you have to collect at least 100 to 250 ml of fluid. When you will collect only 10 ml and 5 ml, this is not going to work in sedimentation activity test. So this is the first procedure. You have to collect the fluid. You have to kept it in an airtight manner in a jar or in a big tube in which you can graduate a tube in which you can measure, you can see the different layers, stratification of the human fluid. So the larger fibrous particles are carried along with the foam at the top. It will be settled on the top, and in between the amount of fluid taken to such type of acidification, the fluid will be there, and the finer particles will be there in the bottom. So the time that it takes, we will measure the time. So the time that it will take in forming this stratification, whether it is doing very in a quicker manner or it is taking some time. So that time is very, very important. Although this is not a clear-cut data that it will take only 5 minutes, it takes 6 minutes. But when you will doing it routinely, then you will be able to appreciate that this is the problem in this cattle. So as written in our book and from different sources, normally the sedimentation or the stratification, that the different layers formation occurs generally within 3 to 5 minutes. If the rumen flora is working properly, it will take 3 to 5 minutes only. So if it is more rapid, or if there is a delay in the formation of that stratification, the rapid sedimentation or delayed sedimentation, both are considered as abnormal. So in this practical, we will collect the fluid, we will allow it to settle, we will maintain the anaerobic condition, we will note the time interval. So we will do this practical when you will come here. So for this, around 100 ml of fluid is required. And sometimes absence of any sedimentation activity is suggestive of vagus indigestion. As you know, we have learned several diseases in digestive system, in which one disease was there in which I told that there is no treatment. And similar type of things you might have learned when you were, I think in the 7th semester, before, just when you have joined here. So many cases are coming here in which there absence of feces, there may be obstruction like lesion, there may be left side displacement of abomasum, right side displacement of abomasum, and one very important disease that get misdiagnosed is vagus indigestion, so in which nothing appears. Just we have discussed the different diagnostic technique on the basis of the physical examination, on basis of the change in the shape of the abdomen. Can I ask what is the change in the size, shape and size of the abdomen in case of vagus indigestion on the basis of your theory knowledge? Anyone?
Sir, पेपल शेप एब्डोमेन हो जाता है सर.
Very good, याद है अभी. किसी में मैंने L सेपेड एब्डोमेन भी बताया था. L सेपेड एब्डोमेन याद है? स्लैब साइडेड
LDA सर.
LDA. तो ये थ्योरी भी बहुत इंपॉर्टेंट है, और ये अप्रिशिएट कब करेंगे? जब कोई क्लिनिकल केस आपके पास आता है और उसके ऑब्जर्वेशन में, और उसके ऑब्जर्वेशन के लिए पहला ही क्लास हम लोग ने जब प्रैक्टिकल में यूनिट 1 में विवेक सर ने डील किया होगा, उसमें फिजिकल एग्जामिनेशंस के पहला वाला पोर्शन जो पढ़ाई हुआ है, दैट इज डिस्टेंट एग्जामिनेशन, जो तुरंत जाकर के गाय के समीप नहीं जाएंगे. we will watch the animal from different distance, from either from anterior and most important from the tail region, that is the posterior. And then when we see and when we divide the animal into two different equal parts, and then we will be able to appreciate where there is elevation on the left side, that is on the top left side, where there is elevation and only on the bottom side, on the both side bilaterally, or whether there is elevation on the left side and as well as on the right side. So as you see, as you told the name, the pear and apple combination, that is the papal separate examination. But for diagnosis of this, we may go for this test. We may go for this indirect diagnosis as the absence of any type of sedimentation activity. It is one of the suggestion that it may be a case of vagus indigestion, because this vagus is a 10th nerves, and this nervous disorder is clinically is very, very difficult to diagnose on the basis of certain tests, on the basis of certain examination. That is really, it is a vagus indigestion. You have to depend upon the clinical sign. You have to depend on certain indirect tests. When other tests are negative and cattle are showing just like a physical examination test, we suggest that it may be a cause of vagus indigestion. Now, second very important test is the cellulose digestion test. This is just as you know that only the human, the protozoa and the bacteria have the role to digest the cellulose. On that basis, we do this test. We have to collect 10 ml of strained human fluid in a beaker. Strained means छान करके उसको हमने collect करना है. And in that we have to add 0.3 ml of 16% glucose solution. Then we have to suspend a thread with the help of a glass or a metal bead. With the help of a glass or a metal bead, एक रस्सी से जो कि cellulose का होगा उसको बांध करके उसमें डाल देंगे in a beaker, and prefer the beaker to be capped, because if we do not maintain an anaerobic condition, then it is very, very difficult to maintain the proper microbes, healthy condition or in a live manner. So we have preferably the beakers to be capped to maintain the anaerobic condition for the favorable microbes, healthy microbes, and then we may incubate it at 37 degrees centigrade for 48 hours or 50 hours. We have to left it for 37 degrees centigrade in an incubator, and then we have to watch what happens to this thread, what happens to that bead. The digestion of the cotton thread with the falling of the bead in the beaker is noted against the time. We will note the time after 48 hours. We will start noting the time, or we will see in how much time normally the digestion of the cellulose should take place within 42 to 48 hours. That indicates that the flora is working, the flora of that cattle from which the human fluid is extracted is working. But if it is not working, if there is a delay, suppose 60 hours or more than that hour, the delay time taken for digestion of cellulose thread is indicative of inactive human fluid flora. So that fluid flora is inactive due to certain, maybe the other factor, like the factors, maybe antimicrobials, use of too much antimicrobials, there may be acidosis, there may be alkalosis, that is another thing. For that you have to depend. But for checking of the microflora, whether that microflora of the cattle is working or not, we may go for this type of test if time is more than at least less active flora. So again, the third test is there. We have a glucose fermentation test, just like the previous test, but we need a special saccharometer for this, in which the production of the gas is noted. Again, other two tests are very simple, but in this, the production of the gas is noted. So this is a glucose fermentation test. In this test, we take 10 ml of strained human fluid in a saccharometer, and 0.5 ml of 60% glucose is added and kept at a room temperature, and read the result in 30 minutes. 30 minutes के अंदर में हम result को note करते हैं. Normally, the microflora present in fluid ferment the glucose, resulting in gas production, and this gas accumulates at the tip of the graduated tubes. So I don't think if we have all these things, then we will be able to, I will contact a nutrition person whether how they go for this type of test. Or I think you might have seen this test in the in Department of Nutrition. Anyone? ऐसा हुआ है क्या कोई टेस्ट?
नहीं सर.
ओके, नहीं हुआ है. ठीक है, मैं ट्राई करूंगा न्यूट्रिशन पर्सन से बात करके कि कैसे इस टेस्ट को किया जाए. अदर टू टेस्ट वी विल डू इन आवर लेबोरेटरी, and the staining and the seeing of the microflora in the microscope, all the tests can be done. So the amount of gas produced in 1 hour is expressed in ml per hour. So this is a quantitative test in which the amount of the gas produced per hour can be noted down. So in normal condition, 1 to 2 ml of gas is produced by sufficient microflora in 1 hour under normal condition, and less than this is again indicative of inactive microflora and sometimes overproduction, as in some of the problem in which more gas is produced. For example, in case of frothy bloat, or in other condition of bloat condition, in which more amount of gas is produced, that is very, very difficult to control. So for example, in case of tympani, in case of acidosis, in case of alkalosis, again, the reverse can occur. The gas production decreases because the flora activity decreases. So that can be judged, although all these tests are just, you have to understand, just you have to correlate with the clinical system, because no test is perfect that you can tell that this test, I will do this test and I will diagnose this disease. You have to make a battery of tests. Again, you have to depend as a clinician on the physical sign, on the physical parameters and the physical examination, as well as these tests are just the indication that that human flora is working properly or not. Otherwise, you can collect the human flora, you see the human flora in the microscope directly. The smaller and the larger can be seen. We will come in the next class how we will see the different types of flora and how we can stain. For that, this is the test, and this is one of the most reliable tests. So we will do this test in our laboratory. This is called redox potential test or methylene blue reduction test, MBRT test. This is just a simple test. Just you have to take the help of certain dye, that is the redox dye methylene blue, and the procedure is then take 20 ml of freshly collected human fluid and add 1 ml of 0.03 ml methylene blue solution and mix. Measure the time required for decoloration of the sample using a plain human fluid as on a basis of comparison. And what is the significance of this? Why we go for redox potential test or methylene blue reduction test? It is one of the most reliable tests, as I told. Normally, the active microfilm methylene blue is reduced within 3 minutes. And if the animal is on different types of food, for example, only on a straw, it takes 3 to 6 minutes. If it is an inactive flora is there due to poor ration, it takes more than 15 minutes. And if it is suffering from rumen acidosis, it takes around 5 minutes. So this is some of the tests I will do in our laboratory, and other tests are also for nitrate reduction test. You have to just write down and copy, and by reading this is not good because I think you could be bored when I read all these things. So this is all doing, and we have methylene blue and we have certain dye in our laboratory. Your first role is you just go for their collection of the rumen fluid and examination of the rumen flora. So I think all these are the practical. In the next class, I will start from nitrate reduction. Then I have to teach all this protozoa and other things. I have not arranged this, therefore I am not dealing with it. Okay. So just I am concluding today's practical. Just you have to, all these practicals are very, very important, not only for practical point of view, for clinician point of view, and those who are interested really in the large animal practice. If you have a small setup of this, it will gives you not over the glory, but it will help you in diagnosis only in few cases. For example, if you are looking after the case of a large number of cases of anorexia will come, and most of the time arbitrarily we are giving only some medications. So first we have to check the pH, we have to check the rumen activity test, and all this will help you in especially in large animal practice. Those who are more willing for a small animal, that is another matter. But when you will be posted in the field condition, all this test, if you have a knowledge and doing this, you can set up a very, very small laboratory wherever you pursue. And the very small kits are required, a small dye are required. It's not a very great technique. Just you have to depend upon the collection of the fluids and then staining and then direct visualization. So I think today I will not bore you for a very, very long time. And today just a day for just telling a happy Deepavali to all of you. And I thank you, all of you, for joining this practical class. I know the practical class is not as much interesting as other classes. So, but I am trying to make it interesting by putting some of the picture. In the next class, I will bring the interesting picture of ultrasonography and how the different layers of GI tract appears. What are the different problems that you will see? Yeah, what are the? I have collected the GI tract ultrasonography.